I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about bone health because so many of you have problems. And in the first part of the show, we talked about by 2025, hip fractures can cost up to, what was my number again? $25 billion in just one issue, hip fractures from osteoporosis. So that's a big concern because no one's talking about what to do about it. Keep eating your bad food, your alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. And when you get osteoporosis, we'll put you on medications. But we also discussed that the medications, the standard ones we use, are showing now that the bones are not getting stronger. They're getting thicker, but their strength is actually weaker because they're weaker on the inside. And you can get something called micro cracks, which are little tiny cracks in the bones if you take the medication. So we got a problem. What we're doing isn't working. Cost keeps going up, and yet we keep doing the same thing. What was that? Insanity, right? Doing the same thing over and over again, expecting a different result. So it's not working. I've never, ever in my life seen anyone get rid of osteoporosis by taking medications and or taking calcium. Now, the bone density might get thicker, but again, if we look inside the bone, that's what we're showing here, that it doesn't usually work. Now, I shouldn't say never. I guess it might happen somewhere. But Garrett had a good question at the break. And his question, what about calcium? I'm going to cover that in just a second because that's what everybody's wanting to know about. What about calcium? And I got some good, bad, and ugly on calcium. Again, so bone is living tissue. So let's talk about some nutrients that you need to build this living tissue. If I'm going to build a house, I'm going to need bricks, and I'm going to need mortar, and I'm going to need electrical wires, and I'm going to need toilet seats, and there's things you need to build a house. If I'm going to build a house, and I don't have all the materials that are approved materials, I can't get my building permit and my certificate of occupancy. So even though I built the house, it's not solid enough to be moved into. Same thing with your body. If you're not giving the body the materials it needs to build everything that it needs to be healthy and safe, it can't work. So for example, you can't build bone without vitamin D. Now vitamin D as a regulatory in the absorption of calcium and phosphorus has a role there. And vitamin D levels are low. If you have that, parathyroid hormone increases, and that triggers osteoclasts. Again, osteoblasts build up bone, osteoclasts break down bone. So not enough vitamin D, your parathyroid hormone increases, osteoclasts release calcium into the blood from the bones. They take calcium out of the bones and put it in the blood, and this process over time weakens the bones. So you need vitamin D to regulate your parathyroid hormone to make sure you don't release the osteoclasts and suck calcium out of the bones. Deficiency can create secondary hyperparathyroidism, leading to a loss of collagen matrix, which increases the risk of osteoporosis and fractures, which is the building structure the bone is built on. So poor bone remodeling due to higher osteoclasts versus osteoblast activity occur with low levels of vitamin D. You have more cells breaking it down than you have building it up. I can't stress enough the importance of vitamin D. We talk about it. We did our show on COVID, colds, and flu. We talk about it with immune system. We talk about it with bone health. Vitamin D does so many different things. It's the least expensive insurance policy you'll ever buy. So why you're not taking vitamin D, especially in the winter months, blows my mind. The only way to know how much vitamin D you truly need is to get a vitamin D blood test, and we can do that at our offices. And we do it as part of what we call a micronutrient test. So we test B vitamins and D vitamins and your antioxidant abilities, and we test a lot of different things on this test. Really good test. It's a good snapshot of your health, of your overall health. So you want to make sure that you get your vitamin D levels tested, and if the vitamin D levels are low, you want to make sure that you take your vitamin D. I suggest taking vitamin D supplements from fall to spring. Now, if you're out in the sun in spring and summer and early fall, that's fine. If you're getting about 10 or 15 minutes a day, a couple of days a week, probably 3, 4, 5 days a week, you're in good shape. If you start losing that, if your vitamin D gets too low, take a supplement. I take 5 drops of Dr. Joe's vitamin D3. I recommend D3 and not D2. D2 is usually the medicine is a synthetic version. It has to be converted into D3. So I'd rather you do the vitamin D3, not the vitamin D2. And I take 5 drops a day. We did our colds, flu, and COVID session just last week maybe. And we talked about the importance of keeping those vitamin D levels high. And if you feel symptoms coming on, if I feel symptoms coming on, I'll take 50,000 international units for 2 or 3 days, maybe 3 days, and then cut back to 5,000 again. When I say 1,000 international units, it's 1 drop. So don't think I'm taking 50,000 pills or something like that. So 1 drop is 1,000 units. So I strongly advise that you keep those vitamin D levels where they need to be. Part of it, for many, many reasons, part of it today, of course, being bone health. Vitamin K1 is found in plants and green leafy vegetables. It plays a role in blood clotting, and it's important for bone health. There's a difference between vitamin K1 and vitamin K2 because our Super Greens, and especially the Essential Source, has a lot of vitamin K1 in it. So people will, and I tell people, listen, if you're on blood thinners, you got to be careful to take Essential Source. If you're taking Essential Source, notify your doctor and just say, hey, listen, this is going to be my new diet. I'm going to a plant-based diet or close to a plant-based diet. You don't have to do everything. Don't worry. And I'm going to start taking Super Greens and Essential Source every day. And in every 4 weeks or 8 weeks, whatever it is, I want you to monitor my blood levels. And I want you to see if I need to change my medication or not. I don't think I've ever had anyone have to change their medication because they were taking vitamin K. Now, in theory, vitamin K causes blood clotting. You're on blood thinners. You shouldn't take the blood clotters. Make sense? But I've never had anyone ever have to change their diet or their medication. But you want to tell your doctor you're taking it, and then you got to take it every day. This becomes your new norm, okay? That's K1. K2, vitamin K2, is synthesized by intestinal bacteria, so you make it yourself, and it works with calcium, magnesium, and vitamin D to build healthy bones. So K2 is different than K1, slightly different. It does slightly different things. So K2 directs calcium into your bones, and it prevents it from being deposited in your soft tissue, your organs, your joint spaces. Because as a pain management expert, patients come to me all the time with pain, and we look at their joints, and sure enough, we can see that the joints are starting to get a little built up with calcium. K2 can help drive it out of the joints. So another reason why you should be taking Dr. Joe's vitamin D3 with K2. It's not just about bone health. It's about keeping the calcium out of where it doesn't belong and putting it where it does belong, which is in the bones. Evidence of 7 Japanese trials assessing the ability of K2 to prevent fractures, they found this. When we assessed absolute differences in fracture rates, a significantly reduced rate was found in all fracture sites, with hip fractures reduced by 6%, vertebral fractures by 13%, and other fractures by 9%. So yes, there is a significant improvement with just making sure you have enough K2. And that's why when I made the vitamin D3, I added K2 to it, because they work synergistically, and most people don't get enough K2. Because K2 you usually can get from fermented things like fermented vegetables or natto, which is fermented soy. Most people don't do that. So I said, let me just put it in supplement form. Let's talk about calcium. Finally, we get to calcium. Calcium works with K2, magnesium, and D3. You need all of that. And vitamin D aids in the calcium absorption, while K2 makes sure the calcium ends up in the right place. So D3 gets it into the body, and K2 says, go over here, go over there. Your bones is where it belongs. It doesn't belong in your arteries. If you don't have enough K2, it's more likely to build up in your arteries. So taking high-dose calcium supplements while being vitamin K deficient can actually lead to hardening of the arteries. This is why with calcium, I'd rather you get your calcium from your food and from super high-quality supplements, things like Dr. Joe's Essential Source. So that's where I don't take any calcium supplements, but I eat a good plant-based diet. I get lots of calcium in my diet. I take Essential Source, of course, at least once a day, sometimes twice a day, and my calcium levels are perfectly fine. So yours can be too, if you're doing the right thing. Significant calcium intake is important to prevent osteoporosis because if the body's stores of calcium are low, calcium will be leached out of the bones. But if you're eating a good diet, here's the thing. If you're eating a good diet, you're not eating a bad diet. And the bad diet has the acid foods in it, the alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener, which rob the body of calcium. If you're eating a good diet, you're not eating the bad food, so you actually need less calcium because you're not wasting it on neutralizing the acids in your diet. Did you follow that? So eating a good diet is really, really, really important. And as far as supplements go, Garrett said earlier, be careful about the supplements that they may add to nutrients. Fortified with calcium. Usually it's fortified with calcium carbonate. Calcium carbonate is not a good form of calcium. Calcium carbonate can prevent you from absorbing the better forms of calcium, like calcium citrate. So some people say, well, I take these little chewable antacid pills because they're high in calcium. And I've had doctors do this. Blows my mind. Take these antacid pills as your calcium supplement. That is insanity because A, you need stomach acid to absorb calcium. If you're taking antacids, you're not producing as much acid, or you're reducing the acid levels in the stomach, so you can't absorb as much calcium. It's calcium carbonate, which can block you from absorbing the good forms of calcium, and there's chemicals and dyes in there, and it's going to alter your body's ability to digest food if you're taking a medication you don't need. So I can't imagine a more insane thing to tell people than to take these little calcium tablets. It drives me insane. If you're going to take calcium supplements, again, calcium citrate will be a good idea, but most times you don't need it. Because if you're taking calcium supplements and you don't have enough K2, you're going to absorb the calcium and it's going to deposit in places it doesn't belong. So taking calcium supplements is not something you want to just haphazardly throw into your body. It's not a good idea. I'd rather you increase the K2, magnesium, and D3, and then you utilize the calcium that you're getting from your food. With me so far? All right. So magnesium, really important. Low levels of blood magnesium correlate with bone density, low bone density levels. Several studies have supported the use of oral magnesium supplementation to increase bone density. Magnesium can impair your parathyroid hormone, and we talked about parathyroid hormone earlier, how it affects blood level, calcium levels. So magnesium is great. If you're eating a good diet, you're probably getting enough magnesium, fruits, vegetables, nuts, and seeds. You can take a magnesium supplement if you want to, if you need it. Here's the thing. If you take too much magnesium, you'll get diarrhea. That's what they make milk of magnesia out of. Oh, that's where that word comes from. So, yeah, you don't want to be doing that if you don't need it. Okay, so don't take the milk of magnesia. Don't take milk of magnesia if you don't need it, but don't take magnesium supplements either. We talked about that with vitamin C last week. You take it until you hit what's called a bowel tolerance. Bowel tolerance is how much my bowels can absorb before I start to get loose stools. And so with vitamin C, I said if you feel cold coming on, you want to take maybe 1 or 2 grams of vitamin C an hour until you start to get loose stools. And if you it starts burning your stomach, you can get something called liposomal vitamin C, which is vitamin C encased in a little fatty layer. And that will prevent the stomach upset. But you take it until you get loose stools, and then that's your bowel tolerance, cut back to about 80% of what you took. So same thing with magnesium. But again, eating a good diet is going to be the key. Here's the mineral that so many people are missing. And I'm going to tell you why it's so important. Boron. You probably never heard of it. High concentration of this trace mineral are found in bones and teeth enamel. According to Natural Medicine Journal, boron appears to be indispensable for healthy bone function, and it reduces the excretion of calcium. So 1 lets you absorb it, vitamin D. K2 tells it where to go. Boron prevents it from being flushed out of your system. It may also help in other ways. It's poorly understood in bone building, but we know it works. But here's the other thing with boron. A lot of people come to me, and as we get older, this is going to happen to you, unfortunately. Your testosterone levels are going to start to drop. And as the testosterone levels drop, we can do several things. Fenugreek is a supplement that you can take that'll help naturally increase your testosterone levels. But it's not the testosterone levels that I'm so worried about. It's something called free testosterone. Testosterone is bound up with other proteins. Free testosterone means it's broken free and it's usable by the body. So free testosterone happens when you have enough boron in your body to cleave it off the bound testosterone and make it free testosterone. And if you're deficient in boron, it can affect bone health, but it can also affect testosterone levels. Now, I'm working on a new supplement, actually, that's going to have fenugreek in it, tribulus, which is going to help stimulate adrenal function, and boron to help naturally increase testosterone levels. Now, in our office, our medical doctor can do a hormone panel on you. We can do blood draw and do a hormone panel on you, and then we can put together exactly what you need. Sometimes I'll even recommend bioidentical hormones short term, and until you get those hormone levels back up normally again. So just so you know, a little insight of my supplement I'm working on in the future. I don't even know if I told Garrett this one yet. Working on it to try to get those testosterone levels up. So I'm working on that. But in the meantime, come see us. Let's see if you even need it or not. And if you do, we can always get you on bioidentical short term and balance out those hormones. Because testosterone is important for muscle mass, but not just your biceps and your triceps. Your heart's a muscle. Your sex organs, your blood vessels, your colon. And many times as we get older, we don't build the muscle mass that we need to support the adjustments chiropractically. So sometimes we got to get those testosterone levels up to build the muscle mass up to hold the adjustment better. See how it all starts to work together? This is called functional medicine. Just about every day I get a call from somebody saying, do you guys do functional medicine? Functional medicine is a very broad term, but the answer is yes. Because we work on the nervous system, the digestive system, the diet, supplements, hormones if we need to, pain management. So I think what we do is even beyond what most functional medicine doctors do, because we try to incorporate the best of all worlds, if we can say that. The chiropractic, the nutrition, the digestion, the supplements. So that's why we get patients literally from all over the world. I had a email just before I went on the air, somebody 2.5 hours away. Is it worth coming to see us? I said, I can consult you online. I mean, we can do online telemedicine if we need to, but the best is if we can go one-on-one. Because with chiropractic, you really got to touch the patient. Unfortunately, there's no way to do it over the phone. We haven't figured that one out yet. Here's some surprising information about osteoporosis. You hear about resistance training, weight training, very important. There's evidence supporting the notion that high and moderate impact resistance training benefits bone health. Heavy weightlifting may be unsuitable for older people with osteoporosis. I mean, think about that. You got osteoporosis, you're not going to be, pumping the iron. Low impact resistant training, aerobic exercises, and walking have been shown to have little or no effect on bone loss. Whoa, dude. Wait a minute. I've been told all my life that I've been told this too, but the new research is out. The problem is load-bearing exercises that is most simple to do not produce enough a significant osteogenic load, stress on the bones. Research suggests the load needed to trigger bone growth in the hip is 4.2 times your body weight. Conventional strength training comes nowhere near that. I mean, think about this for a minute. If you weigh 150 pounds, that would mean you'd have to deadlift more than 600 pounds. Not many 150-pound people can deadlift even half that. So staying active is important, but more important is the nutrition. And again, this weight-bearing exercise is the osteoblastic load that you're going to put, bones that are going to build stress that's going to build osteogenic load, is going to be an issue. So what we have to do then is we have to make sure the diet is going to be right. If the diet isn't right, you can be working out all day, it's not going to work. And that goes for all diseases. Exercise is great, but even weight loss. When it comes to weight loss, the body does about 85% diet and about 15% exercise. So people say, well, Dr. Joe, I hurt my back. I can't exercise. I can't lose weight. The answer is, nah, I'm not going to buy that because you can lose weight. Now, as you get older, sometimes it's hard to lose weight. I know that. And so that's when we might need to boost you a little bit. Now, we are working with we're co-working with another company, and they have a machine actually that we can put your body on this machine, and it causes the muscles to contract for you. I am blown away with the results. I've had 4 sessions so far, and I'm amazed at my abs. I mean, it's like I haven't had abs since I was in high school like this. It's really kind of cool. It's not comfortable, I'll be honest with you. But for people that can't work out, back injuries, neck injuries, people that are older, we're looking to do this with a senior citizen trial. Pretty amazing stuff. And you can actually build muscle mass with a machine now. It sends electrical impulses into the machine that causes contractions, which is just blowing my mind. So I'm real excited about that, just letting you know what the future is at Health Plus Wellness Center is the name of our clinics. The future of Health Plus Wellness Center with testosterone supplementation. We already have the medical places and medical treatments in place. The PRP is just like, it's going to be the greatest thing in medicine as far as I'm concerned, to help regenerate and bring down inflammation. We're working with erectile dysfunction. That's going to be another thing we'll be adding to the treatment as well. So a lot of things we're covering to try to cover as much as we can in the anti-aging world to try to keep you as healthy as possible. It's called regenerative medicine, but keeping the body healthy and fighting aging. The results have just been phenomenal that I'm seeing. It's just crazy. So all this is available. Most of it's available already. It's going to be available soon. If not, it's not on the website quite yet, but it will be probably in the next week or so. So pretty neat stuff. And again, so if you want to make an appointment to come see us, stop suffering needlessly. If you have neck pain, back pain, shoulder pain, arthritis, knee degeneration, PRP is like blowing it out when it comes to knee arthritis, come see us. The biggest complaint I get is, why didn't I do this sooner? Why did I suffer for so long? So we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. Chiropractic, nutrition, digestive issues, PRP, hormone therapies. And that works, by the way, the hormone therapy works well with erectile dysfunction too in many cases because testosterone gets lower. And putting together a whole protocol to try to get you the best we possibly can. And if you've ever been in a car accident, ever, if the car was damaged, you were damaged 100% of the time. I am on my knees begging you, please come see us immediately after a car accident, because every day that goes by, and sometimes it's years and decades, but every day that goes by, the problem gets a little worse and a little worse. If the car was damaged, you were damaged 100% of the time. In my career, I've never seen anyone in a car accident where the car was damaged where the occupants weren't. So I strongly advise you come see us. First visit is normally $375. We've reduced that to $149. That's exam, x-rays, consultation, first chiropractic adjustment, going over the x-rays on the next visit, and a complete nutrition protocol. And that's $149. Future care, and most of you are going to need future care, is covered by most insurances. We have cash plans available. Very, very affordable. Chiropractic is the most effective, least expensive treatment for back pain. And I can't imagine why, in any way, shape, or form, you wouldn't be getting chiropractic care as your portal of entry when it comes to health issues. Some, not all issues. You have a heart attack, go to the hospital, of course. Break a bone, go to the orthopedist. But in most health issues, let's start here, and then we can escalate the care. We can go to nutrition. We can go to PRP. We can go to pain management. We can go to hormone balancing. We can go to the machines that can help build the muscle mass for you. So there's a lot of different things that we can cover. And that's why our office, I feel, is a good place to start. So if you want to make an appointment, drjoe.com, drjoe.com. You'll see a picture of me. Right next to my picture, even with my belly, you'll see a link that says appointments. Almost every day, somebody sends me a question. I can't see where to make an appointment. It says appointment. It looks like a calendar. So click on that. Pick the office you want to see. Pick the time. We'll reach out to you. We'll confirm all that. And with insurances, again, we can verify your insurances for you, and we'll handle. We do all the billing for you, including Medicare, by the way. So stop suffering. I mean, 37 years. I've been banging my head against the wall for 37 years, saying, why do people suffer so much when we have answers in most cases? Not all, but most. I don't understand it. And every day, Dr. Joe, I've been listening to you for 5 years, 10 years, 20 years. I should have been coming here sooner. Yeah, you should have. The sooner you get to us, the better. So with osteoporosis, we talked about that. Supplement-wise, I would take Super Greens and Essential Source as your base supplements, of course. Vitamin D3, we talked about that as well. Glutathione, I think, is really important to keep the liver healthy. I take that every day. I take omega-3 fatty acids to keep the inflammation in my body down. My brain needs those omega-3 fatty acids. I take adrenal support because the adrenal glands help produce energy. They produce hormones, and they work as anti-inflammatories. So I've created a personal protocol for nutrition. And when I get my bone mass done, when I get my blood work done, everything is just like amazing. It's like off the chart where it needs to be. If it didn't work, I wouldn't do it. If meatball sandwiches on Italian bread with provolone cheese was better for you than what I'm doing, I'd be doing that, trust me. I can do any treatment I want. I can take any supplement I want. I can eat any diet I want. I know that this is the best thing out there. And again, if there was something else better, I'd be doing it. That's why we introduced our medical department. That's why we're doing PRP with our patients. That's why we're doing sometimes nerve blocks to bring down the swelling so we can do better chiropractic adjustments. Maybe you've been to a chiropractor, you're just not getting the results. Maybe we need to escalate your care. I'm not here to take you away from your chiropractor, please, any doctor. I'm never here to steal a patient. But maybe we can do things to escalate the care to try to get you better. So that's our goal here. Our goal is to try to give you all the options that we can to get you well as quickly as possible. All the supplements are available on the website, drjoe.com. If you have questions, send them to me through the website. Search the website. We have over 1,500 hours of podcasts. Search for what you're looking for. If you come by our offices, Marietta, Duluth, Stockbridge, or West Cobb, you can pick up the supplements, and that'll save you the shipping. And we'd love to see you, too. We'd love to meet our patients and our listeners. So once again, folks, I'm Dr. Joe Esposito, the website, drjoe, drjoe.com. Thanks for tuning in. Follow us on Facebook and Instagram. Catch you next time. Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.